Welcome back to Understanding Human Anatomy and our discussion of the mediastinum. And this is part 3 in this discussion of the mediastinum. Now, what I want to start with in this session is sketching in the pericardium. And I'm going to do that in pink. And the inferior border of the pericardium will conform to the diaphragm and come out to the area of the apex of the heart. Like so. Now, the superior border of the pericardium is the level of T4, the level of the sternal angle. And instead of coloring in the pericardium, I'm just going to draw some lines in to indicate that this is all one structure. Now, I don't think we need to draw in the structures of the heart because we took a great deal of time drawing that in previously in our discussions of the heart. So I'm just using the pericardium as a placeholder for the heart. Now, once we have the pericardium in, we now have a division between anterior and posterior mediastinum. So it would be a good time to review what we've talked about previously. If we look at the sympathetic chain ganglia, they start in the superior mediastinum. They're on the posterior body wall. As they cross the level of the sternal angle, they will come to lie in the posterior mediastinum. And they go all the way down and into the abdomen. The thoracic duct, we started drawing that would be in the posterior mediastinum as it ascends in the right side, and then at the level of the sternal angle it crosses over to the left side and then lies in the superior mediastinum until it enters the subclavian vein. The Azygos vein is primarily in the posterior mediastinum. When it gets up to the level of the sternal angle, it will arch anteriorly off the posterior wall to enter the superior vena cava at about the level of the sternal angles. The arch of the Azygos vein will come to lie in the superior mediastinum. The hemiazygos and the accessory hemiazygos veins lie in the posterior mediastinum, and then the esophagus we see in the superior mediastinum. As it comes down, it gets to the level of sternal angle and passes into the posterior mediastinum until it exits the thorax, passing through the diaphragm at the level of T10. And then we have the trachea, which we see in the superior mediastinum, and it stays only in the superior mediastinum because it divides into right and left primary bronchi at the level of the sternal angle. Now, in the thorax, we're going to see a tiny extent of the inferior vena cava. And I've just drawn this little bit in here on the diaphragm. So, the inferior vena cava is found in the mediastinum. It would be considered the middle mediastinum. And it passes right through the diaphragm and then enters the right atrium. And it passes through the diaphragm at the level of T8. In other words, the most superior extent of the diaphragm. So the inferior vena cava passes through at T8. Next, we want to talk about the aorta. Now, the aorta comes out of the left ventricle and has an ascending part that passes beyond the pericardium to form an arch of the aorta. And the arch of the aorta begins at the level of the sternal angle and then ends at the level of the sternal angle. And then the arch of the aorta continues posteriorly as the descending aorta, which passes into the posterior mediastinum and passes down into the thorax to exit the thorax at the level of T12. So we have the aortic arch, which begins and ends at T4. Draw a line to the arch here. We have the descending aorta, in the posterior mediastinum, and the descending aorta exits the thorax by passing through the diaphragm at the level of T12. And we'll draw a line to the descending aorta. So we have three structures passing through the diaphragm: the inferior vena cava at T8, the esophagus at T10, and the descending aorta at T12. Now, the arch of the aorta has three branches coming off of it. we have the Brachiocephalic Artery, the left common carotid artery, and the left subclavian artery. Putting the labels in, we have brachiocephalic, brachiocephalic artery, and we should say that the brachiocephalic artery divides into the right common carotid and the right subclavian artery. And that would all be in the superior mediastinum. We have the left common carotid artery, and the left common carotid artery is the second branch off the arch of the aorta, and the common carotid arteries, left and right, will be the blood supply to the face, skull, and brain. It's the carotids together supply roughly half the vascular supply to the brain. And then we have the left subclavian artery, and the subclavian arteries, left and right, we've already talked about in the discussion of the upper extremity. They are the vascular supplies to the upper extremity. Then we have the pulmonary trunk, which is slightly anterior to the aorta. And the pulmonary trunk divides into a left and a right pulmonary artery. And the right pulmonary artery passes posterior to the arch of the aorta. And the pulmonary arteries tend to follow the primary bronchi. So we have the pulmonary trunk and the right and left pulmonary arteries. And then we have a ligament coming from the pulmonary trunk up to the arch of the aorta, and that is the ligamentum arteriosum. These structures are all in the superior mediastinum, the pulmonary trunk dividing into right and left pulmonary artery at the level of T4. So let me put some labels in here. Pulmonary trunk, and again that divides into the left and right pulmonary arteries, and I'm not going to label the arteries because I think you can see the branching quite clearly, and we don't want to have too many labels. And then we'll have the ligamentum arteriosum, remember that the ligamentum arteriosum is a remnant of the ductus arteriosus, a vascular structure in the fetus that interconnects the pulmonary trunk with the aortic arch. After birth, the ductus arteriosus closes off. It constricts and blood can no longer flow through it, and that vascular structure then becomes a ligament, the ligamentum arteriosum. That concludes this video, and we'll continue our discussion of the mediastinum in part 4. Thank you for your attention.